Hi, welcome. This will be our ethics case study presentation. My name is Megan Feith. Our other team members consist of Rashida, Roberto, and Rebecca. I hope you enjoy it. This presentation will discuss ethical interprofessional collaboration. Interprofessional collaboration is really a key component of today's healthcare system. You honestly can't work in any sort of healthcare setting without having some interprofessional collaboration. It has been shown to improve patient outcomes, patient safety, definitely enhances communication among healthcare providers, and also helps to increase access to service for all of our patients. Within the last few years, it's become sort of a hot topic. It's now being integrated into nurse practitioner programs, medical school programs, physician assistant programs, speech therapy programs, occupational therapy. Really every sort of discipline has some sort of discussion or course on interprofessional collaboration because it is so prevalent in today's healthcare system. The World Healthcare Organization has really articulated the importance of collaboration in really meeting the goals in primary healthcare. I think it also applies to other settings of healthcare, but the World Health Organization really focuses on primary care. I think that's because primary care providers do a lot of care coordination, but interprofessional collaboration is really prevalent in all aspects of care. And because it's been such a hot topic within the last few years, we're getting a lot more research on this topic, which has really been interesting to see and read all of it as it's coming out, which wasn't so prevalent a few years ago. So now that we've discussed interprofessional collaboration, what does it necessarily mean to have ethical interprofessional collaboration? It is expected that healthcare professionals work to the fullest extent of their education, knowledge, and training, which has the potential to lead to conflict between these different professions if we're all working to the extent of our licensure or certification. Even though each member of the team might wholeheartedly agree with the general notion of patient-centeredness on this interprofessional team, which really calls back to an ethical narrative that is created not only by the professional but also by the patient. Sometimes this can cause some competition between each individual on the team, and each individual on the team really comes with different viewpoints that influence the overall narrative of the team and the approach to patient care. Roles within the team are usually guided by the values and beliefs that were set forth by each discipline. This can be certain ideals about what's right or wrong, what's considered good or bad, and also what is overall ethical. Each individual profession really has their own framework for this, and personally that was one thing that really drew me in to being a nurse and eventually becoming a nurse practitioner, because I really liked that theoretical and ethical framework that nursing came from. Interprofessional care is also ethical because it promotes beneficence, which is quite important. And another ethical component to interprofessional care is that it helps to decrease the overall economic burden of the healthcare system and also helps to prevent errors. Medical errors are a huge cause of economic hardship, loss of time, loss of limb, injury, and really issues within our healthcare system today. But poor communication between providers has also been a source of errors within the healthcare system. So having that interprofessional team helps to hopefully mitigate or decrease those errors and improves communication overall. So as providers, we really have this ethical obligation to work together to build a safe, patient-centered healthcare system and improve overall patient outcomes, our communication with other providers, and help to decrease that economic burden.
Hello everyone, this is Stefano Roberto Gaitan. As Megan was pointing out, there are several benefits to ethical interprofessional collaboration in practice. But how does a facility or a clinical setting implement interprofessional collaboration practice into an everyday practice and make it an actuality? Well, in order to achieve the positive effects of ethical interprofessional collaboration, education of medical and nursing students is required. The successful implementation usually concerns several influencing factors. One of these factors is that in medical and nursing facilities, there must be a dedication to the cause and endorsement of ethical and collaborative care. This being said, in the education setting, there needs to be a tailored approach to making sure there is a collaborative approach in treatment for patients. The next factor would be to alter and adapt the medical and nursing curriculum and making sure it's modified to educate the students on the ethical interprofessional collaboration benefits and how to add it at a practice level. Another factor would be educating actual professors and educators to this process and making sure that the facilities of education hire qualified educators that are prepared to teach ethical, interprofessional, collaborative care. Another component would be to prioritize the ethical interprofessional collaboration learning content, making sure that there is an added value to patients and caregivers in facilities where there's examples of the success of interprofessional collaboration in areas where this is implemented. Converting ethical interprofessional collaboration into actuality needs to have some sort of framework established. As nurse practitioners work to fill the role in assisting the shortages of physicians, there needs to be a successful implementation and evaluation of the roles in a collaborative approach. In order for ethical and professional collaboration to become an actuality, policies need to be modified at different levels of organizations to help facilitate how roles are involved, and this will create a standard, an expectation, and provide a clear vision for those roles. The role needs to be identified and clearly defined so that there's a understanding at several levels of care. Once a facility starts to implement these strategies to promote ethical interprofessional collaborative care, there needs to be an evaluation period to identify areas of improvement and what can be changed to help facilitate interprofessional collaborative care as a standard of care. When implementing this into practice, one of the key triggers for success is involvement. The early stages of involvement are really the key factors, and facilities where stakeholders and physicians work together at an earlier level or an earlier time really showed success in the long term. In some facilities, administration was involved and it helped to introduce roles and got members and teams assisting each other and really opened the door to show the capabilities of ethical collaborative care at a interprofessional level. Moving forward, another critical factor in assisting is the recognition and the willingness of the concept of acceptance. Facilities where they accepted other roles typically had a better turnout in the implementation process and allowed the ethical interprofessional collaborative care to be a standard. Another factor in implementing the practice was the concept of intention. This specifically relates to how roles are defined in an ethical interprofessional collaborative approach and allowed roles to set expectations on how to treat certain populations. In order for the ethical interprofessional collaborative care to be successful in practice, there needs to be an acknowledgement that there are multiple ways and perspectives in treatment. The mentality that there's only one way and all others are wrong is always ending up as an unsuccessful attempt and decreases the chances of collaborative care into actuality. As we move forward, we must continue to educate and adjust frameworks and use the newest evidence-based practice to help mold ways to implement this ethical collaborative approach into an everyday practice.
Hello, my name is Rashida Shah, and I'm going to be discussing some reasons that ethical issues arise within an interprofessional team, how to avoid or prevent these issues from arising, and how to resolve conflicts within an interprofessional team. Interprofessional collaboration has many benefits, including improving patient outcomes, reducing morbidity, and increasing job satisfaction. Generally, each individual in an interprofessional team believes in patient-centeredness. Competition and ethical issues usually arise because there are varying viewpoints on how to provide the patient-centered care. These different viewpoints are a result of different values and beliefs of each member on the team who are influenced by their profession's knowledge and perspective. Each different disciplinary perspective on how to manage the patient can potentially lead to tension or conflict within the team. There can be overlapping between roles, accountabilities, and tasks of the different professions in a healthcare team. For example, there may be overlapping roles and accountabilities between a nurse practitioner and a physician. There can be conflict over the differences in set goals and ethical norms. In order to overcome these conflicts and differences, the role of each member on the team needs to be clearly defined. Additionally, it is important that each member of a healthcare team understand the scope of practice and role of the other members. This can reduce misunderstandings and prevent an individual on the team from getting offended. Moreover, leadership in a team should be chosen based on the problem or issue, not just the position of a member on the team. The individual with the most knowledge or expertise on how to resolve that issue should be put in charge. Next, no member on the team should feel afraid to communicate their ideas or feelings. Each member should be approachable and willing to listen to the other's viewpoints. Each member should feel heard and respected. Furthermore, each member on the team should engage in self-reflection and be aware if they hold certain biases or stereotypes towards any other professional on the team. Each member should also recognize his or her own strengths and weaknesses in order to determine the best way to contribute. Finally, when a member shares his perspective on how to treat a patient, they should also provide an evidence-based rationale to this perspective. This will allow for other members to understand the viewpoint and decide if it is the best course of action to take. If a conflict does arise between members on the team, the leader can take turns to meet with each member and understand why they hold their perspective. The leader who is in the meeting with each member should practice empathy. Next, the members can set up a joint meeting with the leader where the leader can help come to an agreement or resolution. The joint meeting should have a set agenda and allow each member to share their viewpoints.